Welcome back to Questions You Didn't Ask with me, Niasha Fray, and my guests, Jennifer Thornton Jones and Dr. Gail Wyatt. As we continue the series, Ageless Intimacy, Real Talk for Women 40 Plus, let's dive back into the discussion. So as we're exploring these inequities, these barriers to women fully actualizing their whole health and wellness, starting with the preparation for menstruation through the menstrual cycle. And I will say this too, as a comment to what was discussed earlier, is that this idea that young girls are just trying to get out of something when they're telling people that they're in pain. I would like to see that change to, it's okay to rest.
Mm-hmm.
It's okay to take some time to let your body do what it needs to do.
Mm-hmm.
We don't have a society that makes room for women to be able to heal through that process. And there have been some comedic attempts to express how much pain and discomfort women actually go through by producing simulations for men to experience some level of menstrual cramps, right? And we've seen in some of those funny videos, if you haven't seen it on YouTube, just look it up. It's hilarious and it's sad at the same time, right? So just the fact that this pain and discomfort is very real and your body is doing something amazing, right? That's one aspect. But then once we get through that menstrual phase, right, of our life, which is also coincides with our reproductive age, right, our reproductive years, and then our body starts to change again, which can you all talk about what happens in our bodies after reproduction or as our reproduction ages or reproduction time slows down? Because it's not like a hard and fast, like you no longer can have babies or you will no longer have a period, right? We know that it's a phase. And so we've been talking about life course and these different changes and how they can change overnight or they can change over months and years.
Mm-hmm.
And with those changes, our identity changes, the policy and the culture around that time in your life changes. And then the way that we experience pleasure and how we protect ourselves are different. Can we delve into that part of our lives in the life course now?
Well, I like to celebrate the age of 40 with clients who come in to learn about their bodies and or redefine themselves differently when it comes to sex and reproduction. Because 40 is the age or around that period where women have the ability to really enjoy their sex lives. Usually they've had any children that they're going to have. That's not always true. But for the most part, they've made decisions about that. That's going to change because of not being able to control our own reproduction. We're going to have much older women with children than we do now. But that's the age where we usually have experienced some sex, and that we can begin to just focus on pleasure instead of reproduction. And that's if that works generally. I'm speaking in generalities. And it's ironic, I think, that men's sexual peak occurs a lot earlier than that, around 17, where they can have multiple erections and ejaculations in the course of one day that would just tire anybody. It's just amazing. Their little bodies are overworking at that age. So by the time a woman gets to the point where she can kind of organize her life, made decisions, and going on now to just enjoying herself, she might find that her partner, depending on the age, is not able to keep up, doesn't have the same interests, same motivations. So this really creates a crisis for many women in that they see their reproduction ebbing, slowing down to stop. So that's not a source of pleasure in a relationship. It has to just be pleasure alone. But then who are their partners supposed to be? So that's where a relationship really has to take its finest hour, where communication, creativity, doing things that, and talking about things and environments that induce relaxation and pleasure have to be brought in. It's not just what our bodies can immediately do, it's what we can do to make sex and make relationships more positive, or just make ourselves more positive. You don't have to have a partner.
Mm.
That's a very, I think, interesting time for a lot of people because they have to redefine priority on finding a relationship if they haven't found one, and just being able to accept themselves. I am enough.
Mm-hmm.
And for women, that's a hard conversation,
Mm-hmm.
especially if they haven't had any children, they have no partner, and they're alone,
Mm-hmm.
and with a raging sex drive.
Mm.
Yeah. So I think from a physical side of things, also what is like feeding into that during that time period is we talk a lot about menopause, meaning, so the medical definition of menopause is that you have not had a cycle for a year.
Mm-hmm.
But women who kind of get on that other side of menopause are a very different group than women who are in perimenopause, which can be up to 10, 12 years for some women.
Mm-hmm.
And this, you're going through more secular hormonal, you have higher highs and lower lows. It can be different for people, can be varied month to month. So this relationship that you developed with your period is changing itself. And so that in itself is also going to be changing. Like you might have different sexual response
Mm-hmm.
and different physical response to sexual stimuli in a more varied way throughout the month.
Mm.
And so again, if you have not really been taught what like your normal is, or maybe you were someone who was on hormonal birth control and so you
Mhm.
never really experienced like what that was for your specific body, now you're kind of being tossed into this ocean of fluctuation and sort of without a paddle for a lot of women because we don't, again, where's the education around this?
Right.
Right. So now you've got this change in your relationship with your own body. Your physical body is not responding the way that it normally would. And now you have a partner who's looking at you being like, well, this always worked before, or this was always like okay time, or like, so
Yeah,
your partner's head is spinning.
Yeah.
And then you've got all the social stuff involved. So
Mhm.
maybe you guys have gotten out of the stage of like young children.
Mm-hmm.
And so there's like some communication stuff going on there, stuff going on with your careers. Like there's just so much that's feeding into it.
Mm-hmm.
So if you're not communicating about these changes, everyone's making an assumption as to why your body isn't doing the thing it was doing before, why your partner isn't doing, everything's changing, right? And if that communication piece isn't there, both with yourself and maybe your medical provider, and with yourself and your own body, and with yourself and your partner, if that communication and awareness isn't there, you know, you can flounder really.
Yes, and you can get depressed.
I mean,
because
isn't, I think
a whole new
Dr. Wyatt,
script for you. You have to create a whole new script in order to go on with the next 10, 15 years of these kinds of changes, because there's no one who can tell you it's going to be just this way. It's all over the place because your hormones are ebbing or flowing or stopping and starting, and your body changes and your moods change with it. So it's a challenging, and your sex drive also is still there. You're not dead, and
no,
you want to be appreciated regardless, but you're just not the same woman. And first thing, of course, talking about it is that you've got to get a basic knowledge of what's changing and what you need, and accept it and keep working with it as it changes, so that no matter whether you're accepted or not, or understood or not, or you're grumpy or you have a very quick reaction to anger, you can come back and say, hey, that mood has changed. I'm out of it. I'm better. I'm calmer, whatever. I'm really sorry. I reacted too quickly. Let me back up and say what I really feel I should have said a minute ago. That ability has to also be going along with all these changes, because just for a person to be rigid and in denial, and not understand that they're very hard to read, so to speak,
Mm.
from 40 on, it makes relationships really brittle and easily broken if a person isn't patient and isn't humble enough to admit, I don't even know who I am. So I don't expect you to know anymore. But if you just work with me, I'll figure it out.
And Dr. Wyatt, am I right in thinking that this time period in women's lives, they're more at risk for some of the psychological sort of impact that you're talking about in terms of things like anxiety and depression,
Yes,
suicide?
and that's why I said this change, since no one says you should look forward to this and all the changes that have to go with it, is a shock for people. You know, they've gotten their bodies they're beginning to get their bodies together, exercising and, maximizing the time that they use to eat right, because maybe little children aren't around them. They can spend more time thinking about themselves, and should spend more time thinking about themselves. Now, when women have children closer to 40, that period may be delayed until about 45, 46, closer to 50. But a woman has to recalibrate before reaching menopause, or else menopause will be the period where she becomes extremely depressed. Because now she can't have children at all. Everybody counts her out. She can see folds between her breasts and her stomach. Her skin is loosening. She's beginning to look like her mother, and it is not a good thing. It doesn't feel good because her vagina's dry, and she can't figure out, if she's not a lube fan, how else to get other than having sex in water, which really doesn't make it any better. But anyway, trying everything humanly possible to go back to the old days, and not realizing, once you begin to walk through that door, you going back doesn't fit anymore. That you have to recalibrate, redefine yourself, understand what changes. This is me, right? I was a part of the period of time where women were told not to use hormones as they were going menopause. That was not good. That was going to give you cancer. And even though we all wanted estrogen was like a drug. People were saying, you have estrogen? This period of time, nope, you weren't supposed to embellish your estrogen that was leaving your body. And it was hard to live without estrogen. Then the research said, well, no, it's okay if you have a little bit. Well, so what's a little bit? So does that mean you use a cream around your vagina? Just a little touch of estrogen could make such a difference. I mean, it was crazy making. And nobody wanted to just kill themselves and use something that they knew, well, some people didn't care. You will only appreciate what I'm talking about when you get to this period of your life. Look at your skin to see how dry it becomes. And all of the things that you took for granted, you see now yourself in a different way. And you realize estrogen is a powerful hormone.
Yes, it is. Yes, it is. And I will speak for my breast cancer survivors who had to suppress their hormone levels for cancer treatment. I will speak about my own experience in that when I was given medications to suppress my estrogen and my hormone levels so that I could survive and be here to conduct this conversation and many other wonderful things that I've accomplished since that phase in my life. I talked with my oncologist, and she and I are still very close. One of my favorite people in the world. And her and her team, her nurse practitioner. And I was like, why is this happening to me? Why do I feel this way? Why are these changes happening? Because for full transparency, I was diagnosed at 39.
Wow. Mm-hmm.
That's another thing that's happening to Black women that we'll be talking about probably in another episode. I turned 40 while they were preparing me for chemotherapy.
Mm-hmm.
And she explained to me that estrogen, she said, when you're young and everything, like you almost glow,
Mm-hmm.
and your skin and your hair and everything is just right, and your body, she said, that magic that women come with, where they walk into the room in their 20s,
Mm-hmm.
early 30s, and they're just mwah, I said, yeah, because I'm that girl, right? Yeah, I remember her. She was like, that's your magical hormone estrogen,
Mm-hmm.
and we are actively suppressing that.
Mm-hmm.
My heart broke.
Yeah.
And then to find out that, we were suppressing it earlier than what it would naturally
Right.
happen in my body, right?
Right.
So one of the things that I also want to talk about before we get into this exciting survey that we got such an overwhelming response on is the fact that, we talked about vaginal dryness, we talked about
Mm-hmm.
arousal, we talked about all these other things. But can we talk a little bit about, especially Dr. Wyatt, you mentioned how in this phase, 40 and up, women may have experienced a divorce.
Yep.
They may be newly single.
Mm-hmm.
They may be coming out a period of self-ascribed celibacy.
Mm-hmm.
And be interested in embarking in a new sexual relationship with a new partner.
Mm-hmm.
And there are some beliefs and attitudes that we have about what it is to keep ourselves safe at a young age,
Right.
when we're vibrant and full of estrogen and full of energy, and we're highly sought after, and we are this young, supple sexual prize, versus what our expectations are of condom use,
Mm-hmm.
what our expectations are in terms of talking about STDs, getting tested,
Mm-hmm.
what that looks like, what that sounds like in real life. And then what are the real risks involved?
Mm-hmm.
Are women looking at men who are established, who appear healthy, who have a good bank account,
Mm-hmm.
who are sweeping them off their feet, falling into the fantasy?
Mm-hmm.
And what does it mean in real time to either embark in that conversation and or embark in that sexual encounter? And what types of risks may be involved, considering how their vagina has physically changed?
Mm-hmm. Wow, is that a loaded question? I don't know where to begin. Well, this is a period of time where relationships will change, particularly when your children are entering the final phases of high school in particular. That's a high risk period of time. So are the elementary school years as children approach the 6th grade. So in other words, the magic of being a new parent has faded. You know how to do that, and your child can walk and talk and has all kinds of issues of their own. And that's when, family life gets really complicated. We'll have to have counseling, and they've got to have after school activities, and you're just running all over town. I certainly did and enjoyed it. But it's an active life. And for some people, they want to recalibrate with a whole nother partner. And usually it's the male partner that wants this recalibration. So it's hard. This is where a good relationship with another woman who may be older, if not your mother or your aunt or a cousin or somebody, really helps. Because what I was told by all my mother's friends, as well as my mother, is you ought to have your own life and your own money. Now, it may not be much money, but it's yours. And nobody knows where it is, and nobody can take it away from you. Same with a job. Your work is what, and I believe in God, so I'm going to just be biased. God put you here for a reason, not to be somebody's partner, but there's work you need to do. And I find that women who have that same understanding that they have a life and a purpose and they have a safety, financial safety, navigate this period of time much better because they don't feel dependent on somebody else for that redefinition I'm talking about, that recalibration. They can do it. It's not easy. They may not want to do it, but they can do it for themselves. And that's where masturbation, if they have not been interested, didn't want to learn it, don't believe in it, that's when we get into some major masturbation discussions and demonstrations of how to use a condom so they know how to put a condom on. Not having one. They not only have a stash of them, they know how to take those suckers out and put them on a penis. Even a flaccid penis. I mean, these women get good because they're serious now. They've decided, okay, I'm going to accept all these changes. I can manage. It's not easy. I didn't ask for this, but I'm going to manage and I want to live. I'm not here for the purpose of somebody else toying with my life and my health. That's the education that goes so much better when you're young. But if you don't hear it, it's better to hear it later than not at all. I don't know. What do you think, Jen? I'm sure this is when you see a lot of your clients.
Yes. And I think, so I did want to, we had talked a little bit about lubrication before. And I know I'm always coming back to the physical, right? But like lubrication is great to use when you're having penetrative sex or external touch. It's great for that. But vaginal moisturization and doing that regularly as a self-care is amazing. And really should be something that anyone who's noticing vaginal dryness should start to do. And really just the simple one that I usually tell most people to start with, very cheap and cost effective, is just coconut oil. The second thing I usually talk to people about is, do you have a self-sex practice? And if not, how do you feel about that? And if you feel uncomfortable about that, here's a list of sex therapists you should talk to. So I think of myself sometimes as almost like a gateway to try to get people into sex therapy. Because sometimes this is the first time this stuff is kind of coming up. But I think that what you spoke to there about like that agency of being responsible for your own arousal and your own sexual safety, sexual health, you know, it is a time of your life where you're just starting to really kind of like wrap your head around that sometimes.
And it's not that people don't hear it, you know, other people as they're growing up. I don't quite know if they're that interested. You know, it's like, okay, I know, you know, I don't need to eat an apple every day. I could have an orange. But when life starts to thin out, literally, along with your hair, then you realize some of these choices are going to boil you down to just you. So what are you going to do? What are you going to make want to wake up? Who's going to wake up? Who's going to wake you up every day? It's got to be you. If that is embedded in you somewhere that you can bring out, it's all the easy. It's easier. If it's not there, then you got to create it. And if you don't, the next phase of the 50s, and definitely you can forget about periods and estrogen, all that stuff. And you maybe learn to, you know, find other ways to lubricate. Maybe you've accepted lubrication in a tube. Then what are you there for? Waiting for your children to have grandchildren? You know, what are you? You got it. Where this is a major phase of production for me. The 50s, you bet. You're healthy. You know better. You have wisdom. You have life experience. Family, friends, if you're lucky and blessed, and whatever, you know, you've got a life that you can enjoy. But if you don't have those things, you've got to really step back and say, I need to work on myself. I don't have the friends I need. These are people who are still competing with me on where we buy our clothes, what clothes are in them, you know, that kind of nonsense. And instead of looking at, as you said, Jen, what do I need to do for myself this week? Do I need a special time where I'm lighting candles? I've got music going. I'm relaxing. Maybe I have a glass of something that relaxes me. It doesn't knock me unconscious, that I'm not addicted to, but I can just have that glass so that I'm relaxing, and then I can do for myself what I need to do to make myself feel good, make my body work.
I think a huge part of physical therapy is goals. We talk to our patients about their goals. What are their goals from physical therapy? What are their goals overall? And a lot of the times when I'm working in our sexual health clinic and we're talking about goals, this can be a time where people get a little confused almost, because most people think their goals should be very obvious to me. And everyone has different goals. And I have to clarify sometimes. I say, would you be surprised that some people come in and their goal from this sexual health experience is not necessarily to have penetrative sex, or their goal, you know, I've had a range of things that women come in and say, all the way from someone coming in and saying, I don't even want to be with my partner. You know, that's their goal for all of the different things we could talk about with sexual health, all the way to someone who's, you know, I've gone through cancer treatment early. I have had a huge change in my body and my libido and my, you know, it's a surgically and medically induced menopause. So it's different than the natural course of menopause. It's faster, it's harder. All of these symptoms might flare up more severely. And, you know, I want to go back to where I was before. I want to have the same strength of orgasm. I want to be able to have, you know, so there's such a wide variety in terms of what people's goals are from a sexual health perspective, but also from a life perspective. And maybe someone's goal had been to get married and have children, and now they're moving out of that phase. And so that idea of even trying to figure out other goals is tough.
It's very hard. Yeah. It's like they have to go back to school. And I recommend that many do.
Thank you for joining us on Questions You Didn't Ask with me, Niasha Fray, and my guests, Jennifer Thornton Jones and Dr. Gail Wyatt. Tune in next week as we continue our series, Ageless Intimacy, Real Talk for Women 40 Plus.